We can speak now to Dr. Bharat Pakania, who is an epidemiologist and senior clinical lecturer at the University of Exeter Medical School and a familiar face to watchers of BBC News. Good afternoon to you. So you are aware, of course, of the three-tier system that is coming in. We're getting details dribbling in over the course of the afternoon. Do you think this is the right way to go?
Yes, but we need a little bit more. And I hope Prime Minister Johnson is going to say, here on in, I'm giving greater autonomy to the local authorities and the local experts to handle their outbreaks. Because going forward, 6, 10, 12 months from today, we will need the shoe leather, the local people, the local experts to handle these outbreaks. And they can do it much, much better than the central approach that we've had thus far.
So that's really interesting. So local people who'll be able to differentiate, for example, between quite where the virus is spreading and how to be able to prevent that. Is that what you mean?
And much more, because we are a lot more responsive. So to use an example, you were mentioning Tiverton there, which is my neck of the woods. I know the lie of the land. I know where all the hotspots are. I know the estates. I know the people. I know where the risk points are. And I can mobilize my environmental health, my Public Health England people very, very quickly, very nimbly, and go into any one of those areas very, very quickly and stamp down a rising number of cases. And that is the way forward, because it allows us a lot more timely responsiveness to control the outbreak.
And when you say stamp down the cases, what do you mean? Impose very, very localised lockdowns?
So, well, not necessarily, but what you will find, for example, is if there is a hotspot that has created the cases, you look at why it was created. So is it a restaurant? Is it a pub? Is it an outing? Is it a shopping centre? And you then bring in control measures not to repeat it and introduce controls for the people who've already been exposed and created as cases. So that way you deal with what you have and you deal with the future not allowing it to happen again.
And do you fear that might create the sort of confusion that we've heard in a lot of people's minds about what the rules are in one area and what they are in another area? What is the case being made for this three-tier system the Prime Minister is about to announce is that it's simple.
It may be simple, but the trouble is that it is centrally directed and controlled, and the outbreaks are still happening. The outbreaks are happening all over the country, and you need the local people to actually control them and bring them down. And therefore, we are not going to, locally, people are not going to invent new rules and things, but they're actually going to what I would call control the outbreak, bring it under control by bringing in measures. Those are not going to be at variance with national directives, but local people will be running it.
And the old solution of using test and trace, we shouldn't lose sight of that, I suppose.
No, we shouldn't. But, you know, there has been a lot of reliance on test and trace, and it is really worrying me because I talk to headmasters, head teachers every day, and they're telling me Johnny has not been tested and therefore mum is sending him to school. And that really, really, really worries me because we have many people unable to get their tests, and they're saying until the test is done, I am not taking any other actions. This is serious. So we need people, whether you are tested or not tested, if you have any signs and symptoms, to pull yourself out of circulation. Don't wait for the test result to tell you to pull yourself out of circulation.
OK, that's very clear. Good to talk to you. Thank you so much. Dr. Bharat Pakania there from the University of Exeter.